How to treat locked stifles in horses. If your horse's hind leg is stuck in an extended position, it may be suffering from a locked stifle. This condition is common in young, developing horses but also occurs in old or poorly developed horses. Have your horse evaluated by a vet to identify the problem and started on a program of careful exercise. Supplements, aquatic therapy, and a change of shoes are also possible treatments, with surgery as a last resort. What is locking stifle and how can it be treated? 1. The locking stifle is an evolutionary adaptation that allows horses to sleep standing up. Vet Gil Riley shares how the locking mechanism can go wrong, and treatment options for when it does. 2. The stifle is the area where the tibia meets the femur, and is the equivalent of our knees. When you pick up a horse's hind leg, the joint bends forwards, just as our knees do when we walk upstairs. 3. When horses roamed wild, this locking of the joint meant that when a predator attacked, a horse could go straight into gallop, while other animals who had to lie down to sleep were left scrambling to their feet, and thus were an easier target. 4. The stifle locks through one of the 3 ligaments that attach the patella, or kneecap, to the tibia, slipping into a groove on the inside of the femur, thigh bone. Welcome to Daily Need Studio. Method 1. Identifying locked stifles. Number 1. Look for a stiff leg. The horse's stifle is akin to a human knee, and it usually bends forward. A horse with a locked stifle will likely hold its hind leg stiff and straight, unable to unlock the joint. Observe your horse to see if it holds its leg taut, and if it drags the toes of its hoof on the ground behind it. Number 2. Monitor your horse's movements. To spot a locked stifle, observe your horse's movement in different situations. A horse with a locked stifle is likely to make shorter strides, scramble down hills, and hesitate at different moments. Walk your horse around in circles as well as straight lines to observe its hind legs and range of motion. Number 3. Check your horse's legs for swelling. If you suspect that your horse might be suffering from a locked stifle, check its hind legs for swelling. Acute cases of the condition are likely to swell, providing a visual indicator. While swelling could be due to another condition, it is important to address injuries by calling a veterinarian. Note that a locked stifle will not cause your horse as much distress as another injury, e.g., a broken leg, so it is not likely to express pain. Number 4. Consult a veterinarian. To confirm that your horse is suffering from a locked stifle, contact an equine veterinarian. A vet will conduct a physical examination of your horse and might use blood tests and imaging technology, e.g., radiography or ultrasounds, to diagnose the issue. If these measures are inconclusive, your vet may try arthroscopy, a procedure where a small video camera attached to a thin tube is inserted into the joint area. An invasive procedure such as arthroscopy is only likely in severe, prolonged cases of locked stifles. Did this video help you? Let's comment below. Yes or no. Method 2. Managing the condition on your own. Number 1. Guide your horse into a movement that will unlock the joint. When your horse experiences a locked stifle, gently guide it into a position that will unlock it. If you are walking your horse and its hind leg gets stuck in an extended position, signal your horse to rein back. This movement will allow the ligament in its hind leg to slacken, allowing the joint to unlock. Number 2. Monitor young horses. If your young horse exhibits signs of lock stifle, simply keep an eye on it to make sure it doesn't develop any other signs of illness. Locked stifle is common in growing horses and often goes away once their muscles are fully developed. Monitor your horse to make sure that the condition doesn't worsen, and adapt its exercise schedule to avoid injury. Number 3. Start a targeted exercise program. If your horse's lock stifle is ongoing and seems to be ruining its quality of life, intervene with exercise. Targeted exercise of its hindquarters will strengthen the tension of the ligament around its stifle, relieving the problem. When treating lock stifle, you should walk your horse by hand instead of riding it. Regular exercise is also a good way to prevent lock stifle, as a lack of exercise is one of the possible causes of the condition. You can attach ankle weights to your horse to work the muscles that support the stifle, strengthening them in the process. You should also walk your horse up and down hills and on uneven terrain to further strengthen the muscles. Number 4. Reshoe your horse. One of the possible causes of locked stifle is ill-fitting shoes. If you suspect that this is the case, call an equine hoof specialist, i.e., farrier, to check your horse's feet. A farrier will likely trim your horse's hooves and reshoe their feet, which may solve the issue. A farrier may also suggest adding pads under your horse's hind feet to raise them slightly, which may remedy locked stifle. Did this video help you? Let's comment below. Yes or no? Method 3. Seeking professional help. Number 1. Ask your veterinarian about supplements. Ask your veterinarian if vitamins or supplements would be effective in treating your horse's locked stifle. Through a blood test, your vet can identify whether your horse has an imbalance of minerals that may be contributing to the condition. Never give your horse any supplements without first consulting a veterinarian. Number 2. Try equine aquatic therapy. If your horse is struggling with locked stifles, look for facilities near you offering aquatic therapy for large animals. Aquatic therapy has been shown to reduce inflammation and improve cardiovascular performance in horses. Ask your veterinarian for further information about the treatment or search online for nearby facilities providing this service. Another option, if you have access to a natural source of water and your horse is willing, is to ride in a creek, river, or lake to strengthen the horse's hind legs. Number 3. Ask about blistering the stifles. Ask your veterinarian about blistering the horse's stifles. This term sounds worse than it actually is. It's a procedure that involves injecting an irritant near the stifles, such as almond oil with 2% iodine, and may encourage the body to strengthen the surrounding ligaments so that the stifle doesn't lock as much. Number 4. Consider surgical intervention. If your horse's case of locked stifles is serious enough, consult your veterinarian about the possibility of surgery. Your horse will take several months to recover and will require numerous follow-up vet visits to remove sutures and check its progress. You will likely also have to administer medication, i.e., anti-inflammatory medicine and painkillers, and watch for complications like open sutures, bleeding, redness or swelling at the incision site, lameness, lack of appetite or refusal to eat.